Hi everyone. This is Unit 6, journal entry for MN668. Today I'm going to talk about a patient that was in her, I'd say early, kind of mid 20s. She was 24 years old. The patient was diagnosed with generalized anxiety disorder. And she was coming in just, from having a lot of anxiety just with dealing with work and just daily stressors that were going on in her daily activities. The patient, um, displayed like all the normal symptoms, like she was having poor sleep hygiene, muscle tension, fatigue, excessive worrying, just over, just normal things. And it just made me, realize that, not realize, but we all deal with, some type of anxiety. Not saying all the time, but it's normal, and a lot of times we try to, I guess, classify or make it seem like, just certain things aren't normal. But, dealing with anxiety and knowing when it's getting to a point where it's not normal or you can't handle it like on your own, is definitely when you do need to see a provider. And luckily for this patient, she did come in, she was seen, she did receive, referral for therapy, also medication to help with her sleeping, or inability to sleep, as well as for her generalized anxiety, and also some relaxation techniques. But, just with that being said, it just, we all deal with anxiety in some form or fashion. And it's, how much are you having? Like, and how are you able, do you internalize it? Do you do, is it at a point where it's unbearable? Is it impairing your daily activities? Is it prohibiting you from being able to function normally at work, function normally at home? And that's when we really need to look at, you know, do you need to see someone for it? Because I feel like in our society, it's just been normalized. It's just something we deal with. We deal with anxiety, and for all intents and purposes, even depression, in some, well, in certain levels, And it just depends on, what level we are. Are we able to function? And for this young lady, she had gotten to a point where she was having a hard time functioning, just doing her regular day-to-day activities. And, it happens. And it's not to say that she'll always, be on medication for this, or it's something that she's going to be dealing with at this level on a day-to-day basis. But it is something that, a lot of times we feel like we just have to deal with, or feel like it's a normal part of life that we should deal with. And it's just good to recognize when you need help or when you do need to go and seek treatment. So that's it. I hope you enjoyed my journal entry, and I will be posting for week 7 also.